See, as I said, dialysis patients were shielded, which means they should not come out. But at the same time, they need to have dialysis 3 times a week. Uh, so 3 times a week. So then they have to come out of the houses for dialysis. So there is a significant risk of exposure to COVID by coming out to the hospital. So initially, when we had COVID patients in the hospital who came in, obviously the dialysis center, we don't want to bring them to the dialysis center because there are a lot of non-COVID patients who come for dialysis in the dialysis center. So what we did is we did dialyze them at the bedside. So if they're in a admitting unit or if they're in any other medical ward, we used to take our home dialysis machines. We've got dialysis machines. We're one of the centers. We have got an excellent number of excellent home hemodialysis program, and we use a next stage machine for that. And we took the machine, which is a portable machine, we can carry it, and the dialysis nurses used to go near the patient, obviously with all the PPE, and do the dialysis at the bedside and keep that machine for that patient for the duration of stay, so that they didn't have to come across to the main dialysis center. So in that way, obviously it's a lot of work for the nursing team, but then we did mobilize the nursing resources in a way, and it very effectively looked after the dialysis patients when they got admitted. And I suppose, I mean, in some centers, they might not be lucky enough to have this facility of doing dialysis at the bedside. And even for us, when the peak of pandemic did happen, we had too many patients whom we had to dialyze in the center. So what we did is we kept one shift of the dialysis shift. Like we can dialyze 3 shifts, morning, afternoon, and evening shifts in a day. So one shift, the evening shift, was exclusively kept for COVID patients. So all the COVID patients or the high suspicion of COVID, we used to bring them in that particular shift. Obviously use all the precautions to minimize the spread from patient to patient and also from patient to the healthcare professionals, did the dialysis and send them home. And we had, because they were coming in the evening shift, and we had enough time to clean the machines and make the area safe for next morning dialysis. And so in that way, we avoided the mixing of COVID and non-COVID patients. But odd case, when an emergency dialysis had to happen, then we used to dialyze them at the bedside. So by doing this, we did tackle this quite effectively. And again, I would suggest for, say, people in a lot of the parts of India, if they want to do dialysis, yes, it is safe to dialyze, but we have to be extremely cautious in using the PPE and also cleaning before and after the dialysis and avoid cross-contamination and cross-infection. And another thing I want to add, Yash, is, as this pandemic worsened, the dialysis facility, the dialysis unit, also we provided dialysis in the intensive care team. One difference to the way we worked during this time, during the peak, is our intensive cares was inundated with COVID patients who are on ventilator, who also had AKI, needing dialysis, needing renal replacement therapy. So what we normally do in intensive care is provide continuous filtration, because they're on multiple medications. So every patient will have a machine and they will be on continuous dialysis, like throughout their time, 24 hours sort of. But once the numbers increased significantly, then we had some issues with one number of machines, and also the supplies, the fluid supply, the tubing supply were in short. And it came to a point where we had to think of out of the box. So in the intensive care, what we did is we provided the same like dialysis, like as we do for outpatient dialysis. In the intensive care, we identified 2 areas, bed areas, where you can get the patients, and our nurses went and helped the intensive care nursing team to do the dialysis in the intensive care. And in that way, we tackled all the patients who needed dialysis. So it can be done. The intermittent hemodialysis in the intensive care setting can be done, and that's what we proved during this pandemic. And I know in some hospitals in London and other parts of the world, they also have done peritoneal dialysis in the intensive care setting. As soon as we hear of the peritoneal dialysis, we think, oh my God, how can we do peritoneal dialysis in a patient who is on ventilation? When you put a lot of fluid in the abdomen, it splints and whether it's going to be harmful to the ventilation process. But actually, King's Hospital in London has effectively showed that by doing peritoneal dialysis, they didn't compromise the ventilation significantly and did deal with the kidney failure quite effectively.